This lesson introduces the Clinical Judgment Measurement Model, developed by the National Council of State Boards of Nursing. You'll learn how it forms the foundation of the next-generation NCLEX and how to apply it in study and practice. By the end of this lesson, you'll understand clinical judgment, what it is, why it matters in nursing, how it's measured, and how it's tested on the NCLEX. You'll be able to define clinical judgment and explain its role in nursing practice. Understand the 6 steps of the CJMM. Identify how clinical judgment is tested on the NCLEX. Apply CJMM thinking to NGN-style scenarios. What is clinical judgment? Clinical judgment is the nurse's thought process used to observe, interpret, prioritize, decide, act, and evaluate patient situations. It goes beyond knowledge. It includes critical thinking, decision-making, prioritization, ethical judgment. Why it matters. Strong clinical judgment isn't just helpful, it's essential. Most nursing mistakes don't come from not knowing enough, they come from poor judgment. It's what allows nurses to respond quickly and safely in real-world clinical situations. That's why the NCLEX now puts clinical judgment front and center, testing how well you apply your knowledge to real patient care scenarios. Now that you understand what clinical judgment is and why it matters, both in practice and on the NCLEX, it's time to see how it's measured through the nclex-pn's Clinical Judgment Measurement Model. We'll then walk through each of its 6 steps in detail. The National Council of State Boards of Nursing developed a 6-layer decision-making model called the Clinical Judgment Measurement Model, or CJMM. It breaks down the reasoning nurses use in clinical practice, and it's the foundation of NGN-style questions. The model consists of 6 steps. For Step 1, recognize cues. In this step, nurses gather relevant data, charts, vitals, patient statements, and ask, what is important here? For instance, recognizing cues such as low oxygen saturation, complaints of chest pain, or changes in vital signs can be critical. Identifying these early signs allows nurses to anticipate problems and take timely, effective action. For Step 2, analyze cues. Interpret what you've observed, compare to normal findings, and ask, what do these signs suggest? What's abnormal or concerning? For example, if a patient has an elevated heart rate and low blood pressure, that might point to hypovolemia or early shock. Interpreting this data helps nurses connect the dots, understanding what the signs mean and what might be going wrong. For Step 3, prioritize hypotheses, choose the most likely and urgent explanations, and ask, which condition is most life-threatening or urgent? For example, if a patient presents with abnormal vital signs, could it be an infection, bleeding, or a medication error? Your job is to identify which explanation needs immediate attention and action. For Step 4, generate solutions. Here, you identify appropriate nursing actions and interventions based on your clinical judgment. Think critically, what can the nurse do independently, and what requires a provider's order? Decide on appropriate actions. What can I do now to help this patient improve? Examples include elevating the head of the bed, administering oxygen, or notifying the provider promptly. This step turns your analysis into action, moving from what you know to what you do. For Step 5, take action. Implement interventions. What needs to be done right now to stabilize the patient? Your actions should be timely, safe, and based on priority, especially following the ABCs: airway, breathing, and circulation. Examples include rechecking vital signs, administering medications as ordered, starting an IV, or preparing the patient for transport. For the last step, evaluate outcomes. Assess if your actions worked. Is the problem resolved? Or, do I need to escalate or reassess? For example, after giving a pain medication, check if the patient's pain level has decreased. Based on what you observe, decide on your next steps. Now that you've learned the 6 steps of the Clinical Judgment Measurement Model, let's connect them to the exam. This next section will show how clinical judgment is tested on the NCLEX. The NCLEX now includes case-based questions designed to test your ability to interpret patient scenarios, make nursing decisions based on limited data, and select the correct actions in a realistic and clinically appropriate order. The NGN case study format is structured around the clinical judgment measurement model. Most scenarios follow the model step by step, with each phase assessed through specific item types. Recognize cues through multiple-choice highlight or drop-down questions. Analyze cues using select all that apply or table-style formats. Prioritize hypotheses with drag-and-drop activities that ask you to rank or sort based on urgency. Generate solutions with matrix or multi-select items focused on identifying appropriate interventions. Take action using highlight or bowtie questions that assess real-time clinical decisions. And evaluate outcomes with drop-down or grid formats to determine if your interventions were effective. This structured format mirrors real-life nursing and helps ensure you're ready for safe clinical decision-making on the job. Let's walk through a clinical scenario using the clinical judgment measurement model. Here's the scenario. A patient with pneumonia has an SpO2 of 88%, a respiratory rate of 28, is using accessory muscles, and reports fatigue. Now, let's break this scenario down using the clinical judgment measurement model. The table is organized into two columns, the CJMM step and the nurse's thinking at each stage. Recognize cues. The nurse first identifies key findings. The patient has a low oxygen saturation, is breathing rapidly, using accessory muscles, and reports fatigue. These are early warning signs that something is wrong. Analyze cues. Putting these clues together, the nurse recognizes signs of respiratory distress. This isn't just one abnormal value, there's a pattern that points to a bigger issue. Prioritize hypotheses. Among all possible problems, the nurse decides hypoxia is the most urgent. Without quick intervention, it could quickly worsen. Generate solutions. The nurse considers what might help: raising the head of the bed, applying oxygen, and closely monitoring the patient's status. Take action. The plan is carried out, placing the patient in high Fowler's position and starting oxygen via nasal cannula. Evaluate outcomes. Finally, the nurse reassesses. The SpO2 improves to 94%, showing the intervention was effective. This table shows how each step of the clinical judgment model helps break down a real scenario, from identifying early warning signs to evaluating the results. It highlights how clinical thinking builds across phases to support safe, effective nursing care. You've walked through what clinical judgment really means, why it matters in nursing, and how it's measured on the NCLEX. You also explored the 6 steps of the clinical judgment measurement model and began applying them to NGN-style questions and real patient scenarios. Now, let's do a quick recap of what you've learned. Clinical judgment is the nurse's ability to think critically, make safe decisions, and prioritize care in real-life situations. The NCLEX now focuses heavily on this skill through the nclex-pn clinical judgment measurement model, which includes 6 interconnected steps: recognizing cues, analyzing those cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. Each step reflects how nurses assess patient needs and respond safely and effectively. On the NCLEX, especially in next generation, NGN, case-based items, these steps are embedded into questions to simulate clinical scenarios. Mastering the CJMM framework is essential for approaching NGN questions with confidence and developing real-world nursing thinking.